Never tell your patients how long it's going to take to get better. I know that sounds counterintuitive, but let me explain why. The way that most of us approach this topic when it comes to giving patients expectations about the recovery is we are trying to answer the question in our heads, well, how long would it take to get to 100%? And we're trying to then verbalize that to the patient. And that's tricky because there's variation in that, right? Like we can't know, is it going to take 2 months, 3 months, 6 months? Is it possible that they're going to have maintenance care to stay that way? These are all things going on for us, and we're trying to give patients a concrete answer to that. When they say, how long is it going to take to get better? They want us to put a number on that. And the only way to do that accurately is to be vague, is to kind of go, well, like most people, it's around 3 months, but that varies a little bit. It could be like 5 months if this is going on. We go straight into kind of mode. And as soon as we do that, we lose credibility, we lose authority, and the patient starts to go, oh, you don't really know. And that creates anxiety for them because they want to hear you say something concrete. They want to hear you not respond to that question with something vague. So the reason, this is the reason why I say, don't actually try and answer the question, how long will it take to get 100% better? Now, when I'm giving a report of findings, I'm outlining a treatment plan. Does that mean I just leave it open-ended? No, of course not. We have to address the expectations. But this is a trick that I developed a while ago that works really, really well, where we flip things around. I don't give them the expectation about how long it's going to take to get to 100%. What I do is I give them something concrete, a set amount of time, and I give them an idea of how much improvement I expect within that time. So let me flesh this out a little bit. Rather than saying, getting this sorted is probably going to take, around 3 months, maybe 4, or go, well, we'll start with this many times a week. And then as you get better, we'll go weekly for, maybe 2 or 3 weeks, and then fortnightly for a couple. The longer you talk about the plan, the more kind of vague and grey it gets. The patient's like, this bit sounds certain. I don't know about the rest of this. That's one reason why they leave early as well, is I flip it around and I say, right, let's talk about 3 months. And then within that 3 months, I'm going to offer some flexibility about how things might go within those 3 months. So I would say to a patient, in terms of the overall recovery, what I expect is that over the next 3 months of us working together, or 6 weeks, or 2 months, or 6 months, whatever you happen to choose. But I tend to go 3 months. I see a lot of chronic patients, but I don't want to give 6 months or a year. As I always say, over the next 3 months, what I expect is with us working together, we should get you 50 to 70% fully recovered within that time. 100% will take longer, but most of the work through us working together will be within those first 3 months. Or I might say, over the next 2 months, I'm expecting to get you at least 80, if not 100% recovered. There may be a bit more work to do beyond that, but most of our work will be done within those 2 months. So I'm flipping it around here and I'm offering, rather than saying, getting to 100, I don't know the exact time. I'm saying, well, you know what, this amount of time, I don't know exactly where you'll be. But I'm giving an idea there. Doing it this way is actually much more reassuring for patients because I'm putting a start and end date on the plan. What people do not want is an open-ended plan where it's like, we might be here, we might be there, we might have to go longer. They want to know a start and end date. I've made it very clear that end doesn't mean goodbye, we're done. But I'm letting them know that most of our work is going to be within that time. They can then go, okay, I can plan on 3 months to get mostly there. Yes, there will be some work to do beyond that point. Yes, we may still see each other, but chances are the majority of our visits are going to be within that time there because by the time we get there, things are spacing out. So give this a try when you're giving a report of findings, flip it round rather than saying, okay, the time is the fixed variable. Sorry, the recovery rather is the fixed variable. The time is now variable. That creates anxiety. Make the time the fixed variable and now say exactly where there'll be some variation there. And do it as a range. I don't say I'm expecting 80%. I say 80 to 100 or 50 to 70 or 25 to 50. Just give them an idea and they're not going to pin you down and say exactly where is it there. They just want to get a rough idea, but they want that start and end date. So stop telling patients when it will be 100%. Instead, tell them where you expect they'll be within a certain amount of time. It'll go much better. Patients will actually have more confidence and it feels a lot easier for you to answer as well.